A trip to the hospital is rarely something to look forward to, and many of them are failing to keep up with demand. Not enough doctors, crowded waiting rooms, outdated equipment. So, how can technology help patients and caregivers? And what challenges does digital healthcare present? Find out today on Shift. How can we achieve high-quality, affordable healthcare for everyone? For some tech giants, the answer is remote patient monitoring, or RPM. This involves collecting and analyzing health data remotely. RPM is already common in the US, Europe and parts of Asia. In Pakistan, it's even used in schools to monitor children's health. And the potential goes far beyond the classroom. In Pakistan, seeing a doctor often means long waits and crowded clinics.
When you're taking time off work and you have to spend money to go there, that's a lot of time and money being spent. And then often when you actually get to the doctor or the hospital, you might have to spend another 2-3 hours.
Pakistani health tech companies are now offering digital services to help improve care. The startup Fitwell offers medical devices, software and virtual clinics for remote patient monitoring, or RPM. Patients can then check their vitals like blood pressure or glucose levels at home using digital devices like smartwatches, glucometers and blood pressure monitors. The data goes straight to a doctor through a secure portal. But checking levels unsupervised has its limits. Accuracy can vary. The readings aren't always correct.
Sometimes when the information is wrong, especially when you do blood pressure, you might have had a coffee or something might have happened which pushes up the blood pressure. Okay, but the patient didn't know that.
That's where virtual clinics come in. Here, trained staff help patients take accurate measurements. Doctors monitor patients via the platform and online calls. In underserved, especially minority communities, these clinics are making a big difference.
When you have blood pressure issues or a headache, we come to this virtual clinic. We can access the doctor via video call and can get medicine here. It brings us relief from our pain.
After the initial in-person visit, follow-ups happen online. Schools also use the virtual clinics to track student health. AI supports the system.
So every single transaction that our doctor does, our AI is supervising it. So it can flag up things that might not seem right, and then somebody has to look at it and see, was AI right or was AI wrong?
AI won't replace doctors, but help them work faster and smarter. It can transcribe doctor-patient conversations and manage lab results and prescriptions. Patients can access test results privately via their online profile, where an AI chatbot is available for questions around the clock. Data on the platform is heavily encrypted, and access via multi-factor authentication keeps patients secure. Online medical care now spans countrywide, from cities to small towns and villages, with over 1 million people in Pakistan making use of the platform. But in a country of 220 million, there's still a long way to go. The situation is also complicated on the African continent. For instance, Nigeria is grappling with a shortage of doctors. Currently, there's less than 1 hospital bed for every 1,000 inhabitants. Shortages are particularly acute in rural areas. Healthcare facilities are overwhelmed and specialists are often miles away. Telemedicine aims to ease access via medical care. With a suitcase full of medical devices, nurses travel to patients to conduct examinations. Images and measurements are transferred to a doctor via satellite in real time.
I diagnose such patients through the instrumentality of the machine that's available. All right, we can look at the vital signs, the blood pressure, the temperature, the pulse oximeter, the oxygen saturation. Those ones are critical measurements.
Since the project began, over 600 patients have been diagnosed remotely and enjoyed significant advantages.
I have to postpone getting to the hospital because time is not there. And then money is also involved, having to transport yourself to the hospital. So those might be a challenge. So that way, one might just want to get by to a place, chemist or pharmacy, just get drugs for the meantime. During the video consultation, the doctor was friendly and I felt comfortable speaking with him.
This kind of trust in doctors is crucial. Remote healthcare also often requires you to record health data on your own. So you need to be somewhat tech-savvy and have access to the internet. But technology is just one of the hurdles along the way. Cultural factors can also slow progress. In Pakistan, deep-rooted cultural norms still shape how people engage with technology. To implement digital healthcare, providers are turning to a hybrid model. It combines technology with the human touch that many patients still expect.
The major problem is reluctance. Okay, Pakistan and a lot of countries that they need to physically see a person, be physically touched, and they get this confidence that I'm now being dealt by a real doctor. So the hybrid model becomes very important because they don't go straight to technology, they go through the hybrid situation.
The hybrid model gives people a choice. They can log in from home or visit virtual clinics where staff help record vitals and manage the tech for remote care.
The thing is, a patient likes to go where he receives care and love. It's seeing the doctor. Half the illness is gone when the doctor talks. He can treat us with his words.
For many in Pakistan, healthcare is about trust and human connection. Technology alone cannot provide that. Therefore, remote care must be flexible, allowing patients to choose how they wish to be treated.
It goes even worse. They would rather trust a doctor that has been recommended by one of their friends because that's the doctor that they know than somebody else who's a truly professional. There are just so many nuances.
There's also a gender gap to consider. Nearly 40% of women in Pakistan rely on male relatives to use a mobile phone. Overall, in Muslim-majority countries, taboos around women's health and contraception are big hurdles to overcome. A startup from Egypt is aiming to change that with AI. Be it in the city or in rural areas, women across the Arab world face hidden challenges when it comes to their health. In future, digital tools can offer safe and discreet alternatives for accessing information.
What I loved most is the AI assistant. She speaks my language in a friendly and relatable way. There's no judgment at all. It's very educational and shares all the information it has.
In Arab society, women's health is often not openly discussed in families or schools.
As a result, a lot of misinformation is widespread. There are many myths deeply rooted in families and society. So we had to create a solution for that issue using technology and social media. That way we can reach those girls more easily and effectively.
The app Dalila, created by the startup Mother Being, provides Arabic-speaking women with comprehensive information on women's health in a way that's mindful of cultural sensitivities in the Muslim world.
The chat model is built to understand the cultural background of Arab girls. It's not just a simple Google search. It provides answers knowing that many girls can't ask their mothers or don't get information at school. So it provides them with answers in any dialect, simply and accessibly conveying the information.
What the AI can't do is make medical diagnoses. However, the information offered is drawn from a database which is thoroughly reviewed by experts.
When users ask vague or indirect questions, the app may struggle to interpret them, but our doctors have years of experience that allow them to recognize patterns. Sometimes the user is hinting at deeper issues, so the doctor asks follow-up questions.
The team behind Dalila assures us that user data is safe. It can even be used anonymously too. So no need to register or share personal information. So, digital healthcare solutions rely on many factors: a reliable internet connection, digital literacy, and trust. Sometimes even in doctors that are thousands of kilometers away. A surgeon in Florida recently operated on a patient in Angola, separated by around 11,000 kilometers, made possible by using a robot.
When we first started this connection, the connectivity was too long. The latency, as we call it, was too long, where the signal going to the patient and coming back to me was perceptible. It would make it hard for me to operate. And so we had to modify the processing, the routers, which fiber we were using.
A fiber optic connection from Florida to Brazil, then via the depths of the Atlantic to Angola. The signal passed through 17,000 kilometers of cable. According to the hospital in Luanda, it was the first remote-controlled operation in Angola and Africa. For safety reasons, a US medical team was on site, but no need, the operation went without a hitch. The patient, diagnosed with early-stage prostate cancer, is something of a trailblazer.
It's a real honor for me to be the first Angolan operated on via remote surgery.
For Vipul Patel, the possibilities are immense. As long as the hospital can afford the equipment, procedures could even be performed without on-site personnel.
Now you can help people all over the world at the click of a button. Right now, this robot is connected to Sao Paulo, Brazil. It's connected to Kuwait, Morocco, Shanghai, Angola, and it's about to be connected to multiple other cities. So imagine from one place, now you can help people around the globe.
A doctor operating across continents is incredible. Digital healthcare can save lives all around the world. But technology alone can't solve everything. Navigating issues like trust, cultural differences, and access is the true test. That was it from me. See you next time on Shift.